morning, everyone. It's my pleasure to be here and to have this interview with Georg Nollert, who is the Vice President of Medical Affairs from Biotronic. And we'll discuss a little bit what's going on with the new device, the new bioresorbable scaffold. So, Georg, welcome to Madrid. Welcome to CSC 2022. And can you tell us a little bit about the new feature of the device? What had changed from the previous iteration, the previous McMurray's, the new stent? What is the main features you can tell us, please?
Thanks, Manel. Thanks for having me at CSC. Unfortunately, I couldn't come to Madrid. And thanks for the invitation to talk about our DREAMS program. So absorbable magnesium scaffolds, and we have at the moment the third generation. The second generation was is the McMurray's, which is approved in Europe. And now we have, with the third generation, a lot of improvements. And the biggest difference is probably that we somehow changed the alloy, and this allows us to have more radial strength. And that was probably one of the problems you also encountered in the MAX-DEMI trial. You had just recently published there the 3 years follow-up, and there were actually in the first year a couple of revascularizations in this group. And it was probably due to the fact that the radial force in STEMI patients was at least not sufficient to be comparable to the DES, to the O0, which was actually the comparator. So with the new alloy, also the characteristics of resorption. So it's much better defined now. And so this is what we see, particularly in the BIOMAG 1 study. And what we therefore also see that the late lumen loss at 6 months is much, much lower in comparison to McMurray's. In fact, we are at approximately 50% of what we had with the second generation, the McMurray's.
That's really good news. And let's because as you mentioned, this new iteration with this improving radial force has led to a good results, especially just presented at TCT. Can you explain a little bit more about the BIOMAG results?
Yeah, so the BIOMAG 1 study actually was the first in-man study with a total of 116 patients recruited in 14 sites in Europe. And what we did was we looked actually at an angiographic endpoint that was 6 months. We will have another endpoint at 12 months, which will be presented actually at EuroPCR in May, end of May. And the primary endpoint was late lumen loss. And we, in addition, have also invasive imaging data with OCT and IVUS. And in this group of 116 patients, we had just one revascularization in the first 6 months, so 0.9%. But it's probably not such a big surprise if you have such a low number. But what was really surprising, as said, was the really low late lumen loss. In fact, it was in scaffold late lumen loss was just 0.21 millimeter. And that's definitely comparable to the second generation or third generation of DES. So now the product is really in line with state-of-the-art DES, and therefore hoping or knowing that the long-term results will probably be even better in comparison to metal stents. I think the total, let us hope that we really see yeah, a huge step forward in stenting.
Yeah, that's really good news. So I think that is really now you are there. You have competitive data with the current drug-eluting stents, at least in terms of weight loss. Plus, and I think that is one of the strengths of your device is the safety. There's no any signal of thrombosis, nor was in the previous generation, even though that the weight loss was higher, but no thrombosis appeared, and no thrombosis also in the BIOMAG 1. I think this is one of the strengths of the magnesium alloy and all and of this device.
You have even seen that in the Mac-Bastemi trial with the previous generation. So far, obviously, in 116 patients, no stent thrombosis, but that's not the proof. Definitely not. So it's a little early. But what we have is also preclinical data. We always use a Chandler loop. We see very little thrombogenicity. Mm-hmm. And then looking at the previous generation, the McMurray, which had a higher thickness actually of the struts. But in this generation of scaffolds, what we were seeing was a very low scaffold thrombosis rate. In total, in the first cohort of BioSolve 4, which was actually a study of 1,000 patients, we have seen after 24 months just 0.5% stent thrombosis rate.
Mm-hmm. That's really good news.
Yeah.
What will be the future? What are you planning for the future? Are you planning for a bigger trial? Tell us a little bit about that.
Yeah. So what we are planning at the moment is actually to go for an RCT, which is necessary, somehow also to fulfill the ESC guidelines. And this RCT will start mid of 2024, and it will be actually quite similar to Absorb 3. Mm-hmm. Yeah, so in terms of comparator and also in terms of size. But it will also be a little bit different because in Absorb 3, you had approximately 36 secondary endpoints and another 13 other outcomes. Yeah, we will be a little bit more focused. Mm-hmm. So what we are looking at, and this is why we also start in 2024, we looked at longer term follow-up now, so 24 months in our BIOMAG 1 study, so the pivotal study. The first in-man study, sorry. And then look really for parameter where we, in the long run, could probably achieve superiority against stent. And have that as a secondary endpoint incorporated into the RCT. Obviously, the primary endpoint will be non-inferiority in target lesion failure. As all the studies have the same endpoint.
Okay, that's a very good news. So thank you very much for describing all the feature of the new device and also for the plans for the future. Thank you for being here today and sharing with us all this information. Hope to see you soon. Thank you very much.
Thank you very much, and have a great conference. Bye-bye.